My name is Lieutenant Colonel Sihloho. I am the SO1 Physiotherapy and 1 military hospital in Thabatsoane. Generally, physio is known before COVID, but I need to give you background. It's looked at as a rehabilitation department. Physiotherapy basically means therapy means treatment, but this one is a mechanical one. It's physical. How do we do this? We do it, for you to understand, we do it through baby steps. From lying, to crawling, to kneeling, to standing, to walking. How do we do this? In ICU, passive, that's when you cuddle and pick up the baby. Then you support the baby in kneeling and crawling. Then you support the baby in walking and getting strong to running. That's how it is being done. Now, how do we take this into COVID? Most COVID patients will be in ICU because of the condition of the chest. That's where we come in. We mechanically loosen secretions by doing percussions and vibrations, and we suction them to make sure that the airway is clear, the lungs are clear, and there's good oxygenation. How physically do we can also strengthen the lung physically. How do we do that? Through exercises, ICU, from lying, passive exercises, stretching, getting out of bed, support in sitting, strengthening in sitting, getting to walk in the ward. Going home, advising on how to exercise at home. That's how we intervene. We have two-pronged problems. How does this happen? We have problem with patients. We have to limit the number of patients that keep coming in and out of hospital. So we have introduced a system whereby the patient, we don't make appointments. You walk in, we treat you, we give an advice of how to take care of you. If there's a need for you to come back, we make sure that you come in on the day, whereby there will be few members that will be there as patients, there is social distancing, and you are protected from contracting the virus.
Okay, I'm Captain Zwane. I'm a physiotherapist at 1 military hospital in Thabatsoane. Okay, so our role as physiotherapists is to be part of the multidisciplinary team alongside the doctors and the nurses. So we are basically trying to just improve the patient's prognosis, to decrease the length of hospital stay, and to just help to reduce any complications that might arise, whether it's short-term or long-term complications after the patient leaves the hospital. So we have a number of physios working in the hospital, and we have a good rotation basis so that there's always physios available and on standby should the workload increase. And we have also consolidated our resources into focusing more on the COVID patients, but not neglecting other patients that need rehabilitation. So I think we have a good rotation system in place. Should the need arise for more physios to be involved in COVID, we can definitely pull some out of the other resources that we have. I think one of the biggest challenges is to keep the physios healthy that are working with these patients. This is a respiratory disease that's transferred by aerosol droplets. And in our profession, we are quite exposed to those aerosol droplets. So it's a question of keeping the physios safe that work with the patients, but also being able to have good service delivery. So we are dealing with it well. Like I said, we have a good rotation basis where we have physios that are within the pool that are treating the patients, and we have a rotation basis. So should the need arise where someone might get sick, there's always someone to step in. Service delivery will not be compromised in that way. Yes, the extra physios that might be on standby. So like I said, rotation basis, we always make sure that there are physios available and on standby should the need arise for more physios in COVID. Yes, so it's very important for patients to understand that in terms of exercises, it's not a one-size-fits-all. Your exercises should be given to you by the physiotherapist or someone qualified in cardiorespiratory rehabilitation or chest physio, according to your needs after being evaluated and considering your comorbidities, whether you are a chronic smoker or whether you have any underlying diseases. So some of the exercises we use deep breathing exercises. We use instruments like blow bottles and incentives spirometers that patients can use at home to help them get better as well. And then obviously exercise in terms of mobilization, stair climbing, walking. Those are also some of the very good exercises that patients can use once they get discharged or when they're isolating or quarantined at home. Okay, so one of the exercises we use for patients are called a positive expiratory pressure blow bottle. So this bottle we use especially for those patients that have respiratory secretion buildup in the chest, that are maybe unable to cough it out and have just a decreased endurance in terms of the lungs. So you can make this at home yourself as well. You can even use a 2-liter bottle. Just make 2 holes on either side and a pipe. You are going to breathe in through this pipe and you allow the excess air to go out on this side. Okay, so we're going to demonstrate that now as well. So what the patient is going to do, patient is going to take a deep breath in through the mouth, through the nose, as deep as you can. Try breathing in from the thoracic cage. Don't move your shoulders. Hold the breath 2 to 3 seconds. Then you put the pipe in your mouth and blow out into the pipe. Now I want you to see how long you can blow out for. So today if you can only blow out for 10 seconds, tomorrow you challenge yourself to try get to 12 to 14 and so on. If you want to cough, also take the pipe out and cough into your elbow. Alright, let's try that. Okay, billiard, you're going to try to take a deep breath in through the nose and hold it and put the pipe in the mouth and start blowing out through the mouth. 1, 2, 3, 4, 5, 6, 7, 8, 9. And now he wants to cough and he coughs into his flexed elbow next to the bottle. Okay, and that is how you use your positive expiratory pressure blow bottle. The next equipment physios use to help with COVID patients as well is called an incentive spirometer. Now it's very important to remember these exercises are given to you by the physio after careful consideration of your symptoms and your underlying comorbidities. This advice we are giving you now to show you what we can do, but it's very important to rather consult first before trying these exercises. Now the incentive spirometer is used for deep inhalation. These are your patients now that are struggling with deep breathing and they feel they can't breathe in sufficiently, so they just do this apical breathing from the shoulders. So what we're doing here, the patient is now going to be taking a deep breath in through the mouth and trying to lift all 3 of these balls as much as possible. Okay, so emphasis on breathing from the thoracic cage and not from the shoulders. Okay, so what the patient is going to do first is take a deep breath out, take out all the air in the lungs, then you hold it, put the pipe in the mouth, take a deep breath in as long as you can and trying to lift up as many of the balls as you can. Okay, so the patient sits upright. Now you can take a deep breath. Take a breath out, out as much as you can. Hold it, and now you take a deep breath in. Go, and relax. So should you want to cough as well, the patient can just face to the side, flex with the cough with the flexed elbow. Okay, you're going to try that one more time. And deep breath out, fully out, fully out. And now take a deep breath in. Go, and there we go, and take out the pipe. And that is how you use your incentive spirometer.